I am Diane Elizabeth Dunstan, pediatrician and director of the Athens Neighborhood Health Center. I've been with the center for 24 years, and we've been serving Athens-Clarke County for approaching 40 years, providing primary and preventive health care services in the community.
With the Federal Qualified Healthcare Center, the FQHC 330 federal grant funding, Athens Neighborhood Health Center has submitted a request for funding.
We have been denied many times for many reasons. One of the biggest reasons is because we're in Athens-Clarke County. And it is a county that when you put everybody in one pot, it looks much richer than it is.
When you look at the Athens community in the Athens area, you realize that the uninsurance rate is extremely high. It's around 40% of Athenians are uninsured. You have almost 38% living at 200% poverty or below. And so the idea is how do you create a clinic that can reduce the burden on the emergency room? And federally qualified health centers actually allow you to care for those patients.
If there is a FQHC in the Athens community, then grants that are applied for by other agencies would be looked upon more fondly. As far as health care, it would provide more services for those who are uninsured and underinsured.
At our health center, what we hope to establish is a place where people without insurance and with poor funding insurance can come see us.
We at Neighborhood Health Center had hoped that we would be able to partner with the UGA Medical Partnership. So it was definitely a blow that they chose not to partner with us and did choose Medlink.
So the medical partnership is very supportive of the Athens Neighborhood Health Clinic. They do a great job taking care of the needs of this community. When we looked at the numbers for Athens and in terms of how many federally qualified health centers should be eligible in Athens, our population and demographics would support 3 federally qualified health centers.
When the reviewers look at applications from the same area, they're probably going to want to know, why are we getting 2 applications?
I've reviewed applications myself in the past, and when you see 2 conflicting ones, you try to figure out what's going on there. And most likely you send them back and tell them to get it together.
So for example, currently Athens Neighborhood Health Center, about 2/3 of their patients are pediatrics. Their chief medical officer is a pediatrician. The majority of their care is provided by pediatric staff. And in terms of the adult care needed, they don't really have the support structure there for the adult care. So to us, it made sense to partner with Medlink, another federally qualified health center that's been in existence in Northeast Georgia for a long time, currently has 10 community-based health centers throughout Northeast Georgia, and has been reluctant to move into the Athens community. Again, we don't want to look like we're competing against Athens Neighborhood Health Center. We want to complement the services that they offer. And it seemed that Medlink was better prepared to do that for us.
You know, a lot of the areas where Medlinks are situated, we have patients who are coming from those areas here, driving here, from the Franklin, from the Winder, from the Colbert, from Oglethorpe.
I think what we have actually with the 2 applications are 2 different models of FQHC, one being a traditional model of a community-focused FQHC, which is what the Neighborhood Health Center has put together. The other one is more of a teaching model, and they're not the same animal, I can assure you. And maybe the federal reviewers will see that, and we might be blessed by 2 approved applications.
Our doors are always open for everyone.
Our only hope is to work together to continue to find a way to service the needs of the community with or without federal dollars.
One or both of these programs would make a big difference for us. I'm just praying for both of them.